Pelvic endometriosis is a medical condition that affects women of reproductive age. It is characterized by the growth of endometrial tissue outside of the uterus, typically in the pelvic region. This can cause a variety of symptoms, including pain during menstruation and intercourse, infertility, and gastrointestinal issues. In this video, we will discuss the symptoms, diagnosis, effects on health and fertility, conservative and hormonal management, surgery, and long-term implications, including recurrence. The symptoms of pelvic endometriosis can vary from woman to woman, and some women may not experience any symptoms at all. However, common symptoms include pelvic pain, particularly during menstruation, pain during intercourse, chronic lower back pain, and pain during bowel movements or urination. Other symptoms may include heavy or irregular periods, bloating, fatigue, and digestive issues such as diarrhea or constipation. Diagnosis of pelvic endometriosis typically involves a combination of medical history, physical examination, and imaging tests. A pelvic exam may reveal the presence of nodules or cysts in the pelvic region. And imaging tests such as ultrasounds or MRI scans can provide further information on the location and extent of the endometrial tissue growth. In some cases, a laparoscopy may be performed, which involves inserting a thin, lighted instrument into the abdomen to visualize the pelvic organs and potentially remove any endometrial tissue. Pelvic endometriosis can have a significant impact on a woman's health and fertility. In addition to the physical symptoms discussed above, endometrial tissue growth can cause scarring and adhesions in the pelvic region, which can lead to chronic pain and infertility. In fact, up to 50% of women with endometriosis experience infertility, according to some estimates. Conservative management of pelvic endometriosis may involve pain management techniques such as over-the-counter pain relievers, heating pads, and relaxation techniques. In addition, hormone therapy can be used to regulate the menstrual cycle and reduce the growth of endometrial tissue. Hormonal management may include the use of birth control pills, progestins, or GnRH agonists, which can induce a temporary menopause-like state to suppress ovulation and endometrial tissue growth. Surgery may be necessary in cases where conservative management is not effective or in cases of severe endometriosis. The surgical approach may involve removing the endometrial tissue, as well as any adhesions or scar tissue that may be present. In some cases, a hysterectomy or removal of the ovaries may be necessary. Long-term implications of pelvic endometriosis include the potential for recurrence of the endometrial tissue growth. Even after surgery, endometriosis can recur in up to 20% of cases. Women with endometriosis may also be at increased risk for other medical conditions, such as autoimmune disorders and chronic pain syndromes. In conclusion, pelvic endometriosis is a challenging medical condition that can cause significant physical and emotional distress for women. Symptoms can vary widely, and diagnosis may involve a combination of medical history, physical examination, and imaging tests. Conservative and hormonal management may be effective in some cases, while surgery may be necessary in others. Long-term implications of endometriosis include the potential for recurrence and increased risk for other medical conditions. However, with proper diagnosis and management, women with pelvic endometriosis can successfully manage their symptoms and achieve their reproductive goals.